I'm Pete Van Branken. I'm a veterinarian from Battle Creek, Michigan. I'm here today with Dr. Ciribassi. He's a boarded behaviorist from Chicago, Illinois, which is right around the corner from where we're at. I know that lately we've grown into the society that sometimes has these really big, vicious dogs and stuff. And I think there's clients that really are encouraging their dog's vicious behavior. In fact, I think they're opting out of burglar alarms sometimes in certain communities for big dogs.
Right.
Little guys with big dogs, and the big dogs are aggressive and vicious, and as a practitioner, how do I, what do I say to these people?
I think that's the minority of the cases. We do have situations where people have aggressive dogs and they use them to help protect property, and or if they live in an area where the potential for people breaking in is high, and they like to have a dog who's willing to form a bit of a protective influence for them. But the problem is that the vast majority of the situations is more where they have familiar people to them coming in the home, and aggression towards guests is a very common problem that we deal with in dogs, and you can't really have it both ways. You can't allow your dog to develop territorial tendencies and be aggressive, and then also expect them to be friendly to the neighbor kid who walks in the house. So people have to make a decision on why they have this animal, and can't expect a dog to be all things at all times. We ask a lot of our dogs. I mean, we're asking them to function in society that they're really not designed to function in.
Well, and then the way people behave, sometimes kids move real quick and do things like that, and they're never around kids, so they tell you that the dog's friendly, dog's safe, and they have no idea. Really, to a certain extent, and then we have these other clients that have inadvertently allowed their dog to become aggressive. And you know who they are. You walk in the room and they're like, oh, he's great with everybody. You know what? I'm looking at him right now and I know he's not great with everybody. And they'll fall over themselves when the dog tries to nail you, and you and I have been around the block a couple of times, so we kind of know those dogs when we see them. Yeah, I know what you're telling me, but he's not that safe. And how do you deal with those people?
First thing you have to determine is whether the dog's behavior in your veterinary clinic is truly representative of what it is at home. These people live with their dogs in their home and on walks and interacting with their neighbors. And dogs who are at your veterinary clinic, it's a very unfamiliar, threatening environment. So it truly is possible that the only time you're seeing these behaviors is in the context of the veterinary clinic. But it takes some questioning to find out if that is in fact the case. And if it's not the case, if with some pointed questions you find out, well, he's not really great when kids come over, he tends to keep to himself. He may not bite the kids, but you can tell he's not comfortable. Well, then you need to really suggest that we need to look into this a little bit further. And they may agree, they may not.
Yeah, it's uncomfortable when they don't agree. They're like, he's all right, he's all right. And unfortunately...
Well, it's like telling a parent that their kid's got a problem. They're not going to, if they're not open to it, they're not going to do anything about it. And that's a tough situation. You can't convince someone that they have an issue if they don't see it themselves.
I think you hit on something. I think we don't sometimes listen to what clients are saying. In fact, there's nothing worse than having a room tech come out and tell you, here's what's going to happen when you go in there. Because then you go in there with this.
Right. Going into an exam room with preconceived notions is dangerous. We all have to, we're just trained to look at a history, look at some facts, and develop a preliminary assumption of what might be happening. And I don't think there's anything wrong with that. You have to start to develop a treatment plan in your mind. Like I said, we're trained to do that. But by the same token, you have to be open to walking into an exam room, asking some questions, and then sitting back and listening to the answers, because sometimes the answers you get will change what your preliminary thoughts were. And if you're not open to that, you're going to be forcing a diagnosis down the throat of the client and initiating a treatment plan that's inappropriate for the problem at hand.
Let me ask you another question. When somebody comes in, let's say a parent comes in with a child, do you ever ask the child the questions as well as the parent? I think that sometimes the kids are more...
Well, that's an interesting question. And when we do behavior, we try to have as many people who are involved with that dog be present at the consultation as possible, because we get a large variety of different viewpoints from all of the family members, and none of those viewpoints are inconsequential. They all really feed into the ultimate diagnosis of the behavior problem. And not only that, there are different attitudes about what should be done with the animal. So some members of the family may choose euthanasia, that's what they're favoring, where there are other members of the family who won't want that at all. And that's going to really affect how you approach managing this case. So you need those attitudes right up front.
What year did you get boarded?
2006.
Okay, tell me something that you're doing in 2011 or 2012, whatever, that you were doing in 2006. Tell me one thing that you're exactly 180 degrees on now than when you got out of school.
Well, me personally, there's been a lot of development of different medication options that we can utilize in treating behavior problems. So for me, I don't know that there's a big difference in terms of how I behaviorally manage cases, but I think the better question is what some of my colleagues may be doing now that I think is probably 180 degrees different than what it should be. So the big issue really in behavior medicine is the antagonism or opposite viewpoint of some professionals, whether they be trainers or veterinarians, who feel really strongly that people should be, and there's lots of terms that are used, but typically we're looking at terms like alpha and leader of the pack, and you have to be in control and dominant, aggressive, and they espouse approaches that involve things such as rollovers and pinning and using leash corrections and shock collars and things like that. And the reality is most of the problem behaviors we have in dogs, particularly those related to aggression, are associated with fear and anxiety. And when those techniques are utilized, it exacerbates the problem and puts people at risk as well as the animal at risk. So if I wanted to communicate anything to my colleagues, is that as an antiquated, outdated, non-scientific approach to managing most of the behaviors we deal with in our patients. And those approaches not only are inadequate for properly managing the behavior, but it gets in the way of the relationship people want to have with their pets.
Now, when you say your colleagues, are you talking about general practitioners or are you talking about behaviorists?
Mostly general practitioners.
Let's talk a little bit about the predatory cat.
Well, if we're talking, when we define predatory cats, if we're talking about cats who stalk and are non-vocal and inflict fairly significant bite injuries, particularly we're talking about people, that's predation, and that is an extremely dangerous animal, particularly if the animal is in a household where there are people at risk, older people, people with chronic illnesses. It's pretty serious, and the only ways to adequately manage that type of a patient is either isolation and management so that at-risk people aren't exposed. But there are situations where euthanasia is the really only appropriate option, and I do this business because I enjoy working with animals. I enjoy keeping animals together with people, but there are cases where people come first. I mean, there are a lot of cases where people come first, and that's the attitude I think we should have as practitioners. And when an animal is in a household that's putting people at risk, and also when those people in the household are leaning towards euthanasia themselves because they don't know what to do, and they're looking for help and vindication from you or validation from you, then I think as a professional, we are almost obligated to open that door up to them.